Optimizing healthcare resources for quality patient care. Introduction to resource management. Effective resource management ensures safe, efficient patient care while optimizing available resources. Today we'll explore budgeting and financial management principles, time management and prioritization strategies, community resource identification and utilization, cost-effective care delivery methods. Resource management is essential for ensuring patient safety, optimizing healthcare delivery, balancing financial and human resources, enhancing care quality, and addressing patient needs comprehensively. Understanding healthcare budgeting. Healthcare budgets consist of several key components that nurses should understand. Operating budget covers daily operational expenses, includes salaries, supplies, and utilities. Requires ongoing monitoring and adjustment. Directly impacts day-to-day patient care. Capital budget funds long-term investments and equipment. Includes major purchases and facility improvements. Requires strategic planning and justification. Affects long-term care capabilities. Cash flow budget monitors money coming in and going out. Ensures adequate funds for operations. Helps predict financial needs. Prevents cash flow problems. Labor budget plans staffing to match patient care needs. Balances full-time and part-time staff. Considers skill mix requirements. Manages overtime and agency costs. Nurses' role in financial management. Nurses contribute significantly to cost-effective healthcare delivery. Cost-effective care strategies. Choose appropriate interventions based on evidence. Avoid unnecessary procedures and tests. Prevent complications through proactive care. Optimize medication administration and monitoring. Staffing considerations. Support appropriate nurse-to-patient ratios. Utilize skill mix effectively across the team. Minimize overtime through efficient scheduling. Cross-train staff for flexibility. Resource allocation. Use supplies efficiently without waste. Maintain equipment properly to extend life. Share resources appropriately between units. Advocate for necessary resources and supplies. Cost containment strategies. Effective cost management supports financial sustainability. Overtime minimization. Plan staffing carefully to meet patient needs. Use flexible scheduling when possible. Cross-train staff for multiple areas. Address staffing issues proactively. Efficient supply use. Follow proper storage procedures. Use supplies appropriately without waste. Return and use supplies when possible. Choose cost-effective alternatives when appropriate. Energy conservation. Turn off lights and equipment when not in use. Use energy-efficient practices. Report equipment problems promptly. Support environmental sustainability initiatives. Time management principles. Effective time management improves both efficiency and patient outcomes. Core principles. Prioritization. Focus on most important tasks first. Delegation. Assign appropriate tasks to qualified team members. Organization. Maintain systematic approaches to work. Planning. Anticipate needs and prepare accordingly. Time management tools. Task lists organized by priority. Time blocking for major activities. Time audits to identify efficiency opportunities. Scheduling systems to optimize workflow. Common challenges. Frequent interruptions requiring flexibility. High patient acuity demanding immediate attention. Emergency situations disrupting planned activities. Multiple competing priorities requiring quick decisions. Prioritization using Maslow's hierarchy. Maslow's hierarchy provides a framework for patient care prioritization. Physiological needs, highest priority. Airway maintenance and breathing support. Adequate hydration and nutrition. Temperature regulation and comfort. Rest and sleep requirements. Safety needs, second priority. Protection from physical harm. Fall prevention measures. Medication safety protocols. Infection control practices. Love and belonging needs. Emotional support and comfort. Family involvement in care. Social connections and communication. Cultural sensitivity and respect. Esteem needs. Respect for patient dignity. Participation in care decisions. Recognition of individual worth. Support for personal preferences. Self-actualization needs. Patient education and learning. Supporting personal growth. Encouraging self-improvement. Facilitating goal achievement. The ABCs of prioritization. This framework ensures life-threatening conditions receive immediate attention. A. Airway. Ensure the airway is patent and protected. Address any obstructions immediately. Position patients to maintain airway clearance. Monitor for signs of airway compromise. B. Breathing. Assess ventilation and oxygenation status. Monitor respiratory rate and effort. Provide oxygen support as needed. Watch for signs of respiratory distress. C. Circulation. Monitor pulse rate, rhythm, and quality. Assess blood pressure and perfusion. Observe skin color and temperature. Check for signs of bleeding or shock. This systematic approach ensures critical needs are addressed before less urgent concerns. Using the nursing process for prioritization. The nursing process provides systematic care planning. Assessment phase. Gather comprehensive patient data. Identify immediate and potential problems. Prioritize based on urgency and importance. Consider patient preferences and goals. Diagnosis phase. Formulate nursing diagnoses based on assessment. Rank diagnoses by priority and urgency. Consider interdependent and collaborative problems. Focus on problems amenable to nursing intervention. Planning phase. Set realistic, measurable goals. Develop interventions based on evidence. Establish timeframes for goal achievement. Consider available resources and constraints. Implementation phase. Carry out planned interventions. Monitor patient responses continuously. Adjust approaches based on outcomes. Document care provided accurately. Evaluation phase. Assess progress toward goals. Modify plans based on patient responses. Celebrate successes and learn from challenges. Continue cycle with updated assessments. Urgency versus importance matrix. This tool helps distinguish between tasks that require immediate action and those with long-term significance. Urgent and important, do first. Emergency situations requiring immediate response. Critical patient changes needing prompt intervention. Time-sensitive medications or treatments. Safety issues threatening patient well-being. Important but not urgent, schedule. Patient education and discharge planning. Preventive care and health promotion. Care plan updates and documentation. Professional development activities. Urgent but not important, delegate. Routine tasks that others can perform. Non-clinical activities with deadlines. Administrative tasks not requiring nursing judgment. Supply and equipment management. Neither urgent nor important, eliminate. Activities that don't contribute to patient care. Unnecessary interruptions and distractions. Low-value administrative tasks. Non-productive social activities during work time. Identifying community resources. Understanding available community resources enhances patient care and outcomes. Types of community resources. Health services. Community health centers and clinics. Specialist medical practices. Diagnostic and laboratory services. Rehabilitation and therapy centers. Social services. Food banks and nutrition programs. Housing assistance and shelters. Financial aid and benefit programs. Child and elder care services. Mental health resources. Counseling and therapy services. Support groups for specific conditions. Crisis intervention services. Substance abuse treatment programs. Educational resources. Disease-specific education programs. Nutrition and healthy lifestyle counseling. Medication management training. Chronic disease self-management courses. Transportation services. Medical transport for appointments. Public transportation options. Volunteer driver programs. Mobility assistance services. Assessing patient needs for resources. Systematic assessment identifies appropriate community connections. Social needs assessment. Housing stability and safety. Food security and nutrition access. Family support systems. Financial resources and constraints. Health-related needs. Ongoing medical care requirements. Medication access and affordability. Durable medical equipment needs. Home health or therapy services. Example situations. Patients with mobility limitations needing transportation. Individuals with chronic conditions requiring ongoing education. Families facing financial hardship affecting health. Elderly patients living alone needing social support. Assessment methods. Direct patient and family interviews. Standardized screening tools. Collaboration with social workers. Review of previous resource utilization. Connecting patients with resources. Successful resource connection requires systematic approaches. Collaboration strategies. Work closely with social workers and case managers. Utilize hospital and clinic resource specialists. Maintain updated community resource directories. Build relationships with community organizations. Information provision. Provide patients with detailed resource information. Include contact information and application processes. Explain eligibility requirements clearly. Offer assistance with initial contacts when needed. Follow-up protocols. Schedule follow-up contacts to assess progress. Monitor patient success in accessing resources. Adjust referrals based on patient feedback. Document resource utilization and outcomes. Advocacy role. Help patients navigate complex application processes. Advocate for patient needs with resource providers. Address barriers preventing resource access. Connect patients with advocacy organizations. Follow-up and evaluation. Ongoing assessment ensures patients receive needed support. Patient contact methods. Scheduled telephone follow-up calls. Clinic or home visit assessments. Electronic communication when appropriate. Coordination with other healthcare providers. Evaluation components. Assess whether patients successfully accessed resources. Evaluate effectiveness of resources in meeting needs. Identify barriers that prevented successful connections. Determine if additional resources are needed. Care plan adjustments. Modify resource referrals based on patient response. Add new resources as needs change. Remove ineffective or inappropriate referrals. Update resource information as programs change. Documentation requirements. Record resource referrals made. Document patient responses and outcomes. Note barriers encountered and solutions implemented. Track resource effectiveness for future patients. Mastering resource management. Effective resource management is vital for providing safe, efficient patient care. Key principles include: understanding healthcare budgets helps nurses make cost-effective decisions. Time management and prioritization frameworks optimize patient care delivery. Community resource knowledge enhances patient outcomes and satisfaction. Systematic assessment and follow-up ensure patients receive needed support. Continuous evaluation improves resource utilization for future patients. These resource management skills will help you provide comprehensive, cost-effective care throughout your nursing career.